Well, hello to those of you who are here so far. Thank you for showing up on time today. My name is Liz Horvath, and I'm the founder and president of Hale Health and Safety Solutions. And we're here today to talk about managing stress in Alberta workplaces, what every manager needs to know. Now, we are going to be covering a lot today, so I want to familiarize you with your screen controls and just a couple of housekeeping things in order to make this flow really well. First of all, I would like to ask you to turn off all distractions. So if you have your cell phone on, or if you've got your door open or something where people can come in and distract you, I really would suggest that you turn off all distractions so that you can focus 100%. Because as I said, I'm going to be going very quickly. I want to make sure that you don't miss out on anything. And this is going to be some very important information. I want you to honor your time here with me. Another thing I want to make sure of is that everyone can hear me. So you'll notice in your panel that you've got a little button there that you can hit that looks like a hand. If you can hear me, please raise your hand. I want to make sure that everyone is able to hear me. Okay, Natalie, thank you. Tara, thank you. Leslie, Gina, Darlene, are you able to hear me? Okay, I'm not seeing, okay, Leslie, yes, thank you. Gina and Darlene, are you able to hear me? Okay, let me see. I'm gonna unmute the phones and see. I want to make sure everyone is able to hear just before I do get flying along here. Attendees who can talk. Attendees who can talk. Okay, you might have your own phones on mute. Yeah, I really want to make sure everyone can hear me. If anyone cannot hear me, please type it into the chat box. Okay, Gina, you're muted. Okay, that's fine. Okay, but you can hear me. You can hear me good. Okay, excellent. And we'll just put Leslie's hand down. Excellent. So looks like everyone's able to hear me. There looks like there's going to be a few others joining who haven't quite managed to get on right from the beginning, but I do like to honor everyone's time, so I do like to get started. The other thing that I want to let you know about is that this is being recorded, and you will receive a follow-up email with access to the recording. So you don't have to take notes madly. You can just really sit back and focus and listen. And as I said, you will receive a copy of the recording afterwards. So let's get started. Let's get going on this. And if you have any questions along the way, I will do my best to answer questions at the end. I'm going to try and leave about 10 minutes at the end for questions. So jot your questions down as you go along in the question box. And like I said, I will get to those questions. If by any chance I don't get to your question before the end of the webinar today, then I will follow up with you to make sure that I do answer your question. And by all means, if you have any questions following the webinar, please contact me, because I'm very happy to help out, and I want to make sure that your questions do get answered. Okay, so let's move along here. Make sure that my thing is on the right screen. Okay, so the first thing that I want you to think about is, when it comes to this topic of managing stress in Alberta workplaces and the things that managers need to know, I want you to think for a moment, and this I do want you to write down if you have a pen and paper there to write it down. What is your biggest challenge when it comes to this? And also, how will competence in this area affect your organization and your success? And if you'd like to share that with me, then please feel free to type it into the chat window or the question window. But I'll just give you about a minute to think about this, okay? And like I said, if anyone would like to share, then please feel free to do so. Ben and Leslie, I see your hands are still up. I'm not sure if that was just to let us know that you were here. Okay, I see they're down now. Okay, so yeah, Leslie saying employers seeing this as an issue. So correct me if I'm wrong, Leslie, is that employers are not seeing it as an issue? Yes. Okay. So what difference would it make for you if employers actually do see it as an issue for you or your organization? Yep, Ben is saying stigma associated with this issue. Yeah. And Leslie says, yeah, taking steps to address. And I think that's probably one of the biggest things because, you know, as I travel throughout the country and even beyond Canada, I mean, these are the things that we hear. It's the stigma. Because people aren't taking it seriously, they either don't know what steps to take, or they just figure, you know what, it's stress and everybody's stressed out. Why is their stress more important than my stress, or why is it affecting them more? And how do we actually take steps to deal with it? And sometimes it's because people aren't taking it seriously, but other times it's because they just don't know what to do about it, or they don't realize how it's actually affecting their business and even their personal results, both at work and outside of work. So that's really what we're going to talk about today. Some of the other challenges that I've heard from people are, you know, it's we have an issue with burnout, and people aren't knowing kind of what to do to stop it. There's harassment and bullying in the workplace. We've got issues where employees are, you know, seeking accommodation for mental health issues, and everybody's just stressed out and nobody really knows what to do about these things. So these are some of the things that we're going to cover today. Okay, so let's move along here. I just want to introduce you to myself, my vision, a little bit about why I'm doing this work. And as you know, my company is Hale Health and Safety Solutions. And my vision that I see is to have communities just overflowing with flourishing businesses and homes. You know, people have such potential in them. And it's really the environment that we create that allows employees and people throughout the community to be able to flourish and to be able to perform to their best ability. And when we do that, you know, when our employees suffer, everybody suffers. When our employees flourish, everyone flourishes, and it's good for business, and it's good for communities, and it's good for our homes. So I am on a mission to empower people to achieve their personal and professional goals and dreams without the unnecessary suffering caused by chronic stress. And part of the reason for that is that I have, you know, over 20 years in occupational health and safety, and I've dealt with a lot of mental health issues in the workplace and a lot of people issues, and I've seen an awful lot of suffering. But I'm also a burnout survivor myself, having gone through burnout and then having fought cancer over the last few years. And I'm very glad to say that I'm on the other side of that now, and very, very clear on what my mission is. So this is kind of where I'm coming from on this. I do believe that, you know, just like an acorn grows into a very mighty oak tree, every single person has tremendous potential and ability, but it's giving them the right environment. When you don't give them the right environment, they're not going to flourish. And this picture kind of tells it all. A little bit of other background. So throughout my career, I mentioned that I've been doing occupational health and safety for over 20 years. I fell in love with it. I was actually put into it by my coworkers, my peers, back in my days when I was waitressing and WHMIS first came in, and I was voted to be the Joint Health and Safety Committee, the Joint Health and Safety rep for the restaurant that I was working at. And I didn't want anything to do with it. I just wanted to come to work and go home. But, you know, alas, I am a very clumsy person, and if an accident's going to happen, it would happen to me. So they thought that I was the great greatest one to be able to do that role. And actually, I fell in love with it because I do have an ability to kind of see where the risks and hazards are because of my own background in clumsiness. So it really does come to me naturally. But throughout the years, what I ended up doing was going to Ryerson University. I studied occupational health and safety management. And then since then, I have been working in the field. So I've done an awful lot of risk assessment. I've done workers' compensation, non-workers' compensation management as well. I was the project manager for CSA Group for the Psychological Health and Safety in the Workplace National Standard. I worked with Norm Keith, one of the top occupational health and safety lawyers in Canada. When he was with Gowlings, I worked for him for 6 years. And I've done a lot of work with respect to really looking at that integrated approach to disability management. So what's in the middle there is an article that I co-wrote with my colleague Denise Ropp. And if you would like a copy of that article, it is available on my website. You can simply click it and download it. So when we talk about mental health, I'm sure everybody's familiar with the World Health Organization's definition of mental health by now. They say that it's a state of well-being in which an individual realizes his or her own abilities. They can cope with the normal stresses of life, and they can work productively and fruitfully, and they're able to make a contribution to his or her community. Now, I've highlighted can cope with the normal stresses of life because this is where I hear most of the concerns that, how do we help workers be able to cope with the normal stresses of life when the normal stresses of life are literally so stressful these days. Our workplaces are stressful and our home life is stressful. So there's a lot going on. We know that it's not all work-related stress. Employees are bringing stress to work with them, but managers and supervisors are really struggling with how to actually address mental health in the workplace. And in some cases, it's even their own mental health. And if we're not helping them to be able to cope with those normal stresses of life, or even to reduce the risk of stress in the workplace, then we're really setting them up for failure. And it's really important to help them succeed, because helping our managers and supervisors succeed will help their teams succeed, and it'll help the whole organization meet their goals and objectives. Now, here's some of the things that we often hear. I made it through the day. I must have said fine, I'm fine, at least 20 times, and I didn't mean it once. I mean, I see so many times when workers come home at the end of the day and they're just like, oh, I had such a stressful day and I just can't take it anymore. And another one that we see is what we call high functioning anxiety or high functioning depression. And this is someone who you would never know that they have anxiety or depression because they don't walk around looking miserable. They don't walk around, exuding what they're anxious about. But they function well. They tend to be the people that say, I function great under pressure. And some people really do function great under pressure, but not everyone, and not for extended periods of time. Like when you start to do that over a period of years, it really does wear you down. And these are the people that are most susceptible to burnout. So we have to ask the question, what are we missing? And as you can see here, we've got people sitting around the boardroom thinking, well, how are we going to deal with this? That's another elephant in the room. And some people are thinking, oh, this is so difficult. And others are thinking, wow, this is going to be really costly. When really what they need to be looking at is the fact that there are steps that can be taken and they don't need to be that difficult. And if they really looked at what it was costing them right now by not dealing with it, they would realize that there is a huge return on investment for them by taking the steps to actually deal with it and equip their managers and supervisors. So everybody knows Albert, and I love Albert because his wisdom it just rings through everything that we do. And he says we cannot solve our problems with the same thinking that we used when we created them. And here's the thinking that we have to change, that chronic stress is a serious, disabling, and preventable workplace hazard. And it is being recognized. So in this session today, you're going to leave with a clear understanding of how the new definition of health and safety in the Occupational Health and Safety Act in Alberta will affect your workplace or the workplaces that you deal with, and how psychological stress impacts business results and what to do to minimize the risk of stress-related claims and other losses to workers and the organizations that they work for. So we're going to go through how chronic stress causes disability and impacts performance and business outcomes. And the results that you'll get from that is that it will help to dispel stigma through improved understanding and empathy. And it also helps to establish the business case for taking action. So you'll be able to talk about it in more concrete terms. We'll go through a high-level overview of the applicable legislation and standards in Alberta, and it's a very high-level overview. And this will help you to be better prepared to explain why being able to demonstrate due diligence is so important when a manager, a supervisor, or an organization has to demonstrate that. We'll talk a little bit about the entitlement criteria for benefits, and this will give you a better understanding of how to actually discern between the difference between work-related stress claims versus other workplace issues. And finally, we'll talk about preventing disability from psychological stress. And there's a few results there. You'll improve your likelihood of success in areas of, recognition of workplace stressors, prevention, and early intervention. You will reduce the likelihood of disabling mental injury and reduce the costs associated with that. So let's dive in. And like I said, if you have any questions along the way, please feel free to type them into the chat box. I am monitoring that as we go along. Okay. So let's have a look here. So again, I like to ask you to take a moment to think about this question. How is stigma around the ability to cope with stress affecting employees and the organizations in Alberta? So you've already mentioned that that managers are not seeing it as an issue. It's maybe preventing them from taking steps. But how is the ability to cope with stress actually affecting people? Gina's asking, where is the research to prove the ROI on this service? Gina, there's a lot of research out there. I can help to guide you to some of where that research is outside of this webinar. So Ben is saying productivity. So Ben, are you meaning that that the stigma around it is affecting their ability to cope with stress, and that is impacting their productivity negatively? Yes. Okay. Anyone else? So Gina's saying absenteeism. They won't take a mental health day, so they wait until they are physically sick and take time then. Yeah, absolutely. We know that it causes such increases in absenteeism. Darlene saying addictions and higher absences. Yes, absolutely. And addictions tend to be fueled by, when you're having difficulty coping with stress. And Ben's also saying there's no safe places. Yeah, absolutely. Okay, so here is some information that I pulled from this report of the Alberta Mental Health Review Committee in 2015. And as you can see, mental health in Alberta, Albertans are suffering. I mean, 1 in 5 suffering from addiction, mental illness, and sometimes both. Nearly half can't get help for the addiction or mental health issues that they are dealing with. And in fact, less than 30% said that less than 30% of the programs said that they were able to connect clients with appropriate services. So they were actually being refused. Half of Alberta's health services programs, half of them were actually refused entry into Alberta health services programs, and that's of those that were actually seeking help. But more than 60% of people that actually need the help aren't actually seeking that help. And mental health in Alberta only accounts for 6% of the healthcare spending. Now, this is back in 2015. From what I do understand, they have announced some significant improvements in the amount of healthcare spending that they are putting forward. So, yeah, these are very, very telling results, and it's good to see that there's some improvement. But yeah, there's a long way to go. Ben's asking, do we know if anyone is tracking work-related suicides? And that's a really good question. And I have looked into that question, Ben. And the thing is that suicides are being tracked, and we know that there's about 4,000 people who die from suicide in Canada every year. Unfortunately, what I haven't seen is I haven't seen anything where they're actually tracking suicides related to work. This is just something that's starting to come about, and we're going to talk a little bit about that later. Okay. Oh, and you're saying, this has gone up. Some environments are so traumatizing. For example, the military, police, fire departments. Yes, absolutely. Okay, so let's have a look at what chronic stress actually is. The American Psychology Association, in a report called Understanding Chronic Stress, they have said it is a biochemical response, and it's caused by repeated severe stressors, or it's related to daily life in things like insecurities, fear, cognitive distortions, threats to the ego, loss of sense of control, or unpredictability. And I think when you think about these things, you can kind of see with everything that's been going on in our society, in our workplaces, that there is a lot of this happening. There is a lot of insecurity. There is a lot of fear. People don't feel in control. There's workplace bullying and harassment that causes threats to ego. People are feeling very insecure, and things are very unpredictable. So there is this biochemical response that happens when people are feeling this way, and especially when the stressors are repeated or severe. Now, we often say that, the problem with stress is that you can't really see what damage it's causing. So how do we actually know? Well, we can actually see inside now. And as you can see from this slide, researchers, neuroscientists have now discovered that cortisol, which is known as the stress hormone, is actually causing brain damage over periods of time. As you can see on the left, the normal brain has lots of neurons. The one on the right that's been under chronic stress, I'm not sure how long it was, but that's been under chronic stress for an extended period of time, has lost a lot of its neurons. Now, that is causing things like difficulty thinking, difficulty making decisions, difficulty remembering things, difficulty controlling emotions, you name it. So when someone is under chronic stress for a longer period of time, it becomes more difficult to be able to function in daily life and to be able to manage those normal stresses. So this is something that can really open people's eyes to just what is going on inside when someone is under chronic stress, and why they start to head towards burnout and physical disease. What we look for is according to this Yerkes-Dodson model, and you'll see that peak performance is in the green area there, and up to the top. Once we start to get overstressed, we start to get into feeling tired, indecisive, fuzzy-minded, and it starts to go further and further down the arc towards burnout. And burnout is what we used to call a nervous breakdown. And I can tell you from experience, when you hit that wall of burnout, you cannot function. I actually left my last job because of burnout. And here's what happens. The energy and resiliency is going up and down, and your body, mind, emotions, and spirit, it's all part and parcel of it. And normally, I mean, we go through these fluctuations on a daily basis. We go through them hourly, weekly, monthly, even yearly. But what we want to do is try and keep it within a certain range. But as the chronic stress increases, those fluctuations get wider and wider, the higher highs and the lower lows, and it becomes really difficult to function, as I said. Then we have to look at coping strategies. When the coping strategies are positive coping strategies, such as problem solving, emotion focused, and active coping strategies, these help us to be able to deal with those stresses. And that helps us with our resiliency and being able to keep those fluctuations within the normal range, or a healthy range, I should say. When we use avoidant coping strategies, such as drugs, alcohol, maybe lots of video gaming, addicted to shopping, different things like that, or even just, sleeping just to try to avoid life, or withdrawing. These are avoidant coping strategies, and those don't help anyone, and they actually make the problem worse. So we have to look at how to help our employees with coping strategies as well. Now, the chronic stress cycle does lead to disease. We know this. It causes inflammation in the body. It causes chronic disease. It causes all kinds of problems within the job, and that just perpetuates the whole cycle. And the trick is that we have to try and break it. So part of doing that is recognizing the signs and symptoms, and we have to look at the physical, intellectual, emotional, and behavioral signs and symptoms. And I go into that in much more detail in the courses that I teach. So if you're interested in those, we can talk about those a bit later. One thing I do want to stress, though, is that workplace stressors generally increase the odds of poor health outcomes to approximately the same extent as exposure to secondhand smoke. Now, this is a statement made by researchers who had done a metadata analysis of 228 studies looking at the impacts of workplace stressors. And what they found was that it was increasing cardiovascular disease, type 2 diabetes. It was increasing mental illnesses. And what they were saying was that the effects of the health effects from the workplace stressors were actually leading to about 120,000 fatalities in the US every year. Now, I'm sure that in Canada, it's probably not much different. I mean, the effects of stress are the effects of stress. And so this is why we have to deal with it. As I said, it causes chronic disease. So we know that in Canada, nearly 1 million Canadians who are 20 or more years of age have 2 or more of the 4 major chronic diseases that you see here on this chart. And what Health Canada is predicting is that we're going to have a tremendous increase in this. And you'll notice that hypertension is really expected to increase, and that is because of chronic stress. Here's another telling statistic. We have 3.8 million Canadians with disabilities. That's a lot of people with disabilities. Now, the majority of them are 75 years or older, but a good portion of these people are of working age. And a study from Economic Development Canada had said that actually 795,000 of these people with disabilities are kept out of the workplace because of stigma and environmental barriers. So it's not their actual disabilities that are keeping them out of the workplace. Now, when it comes to mental health, we know that there's a continuum. We know that people can become ill, but we know that we can become healthy again. So when you think back to that slide that I showed you where it showed the neurons in the brain, think about the fact that with the proper treatment, with the proper rest and recovery, with the proper supports in place, we can actually help to get people into healthy living again. And that means that they can be productive and fruitful in the workplace and making contribution in their community and living a more joyful life. Now, when we look at the effects of bullying, the effects of chronic stress are just amplified. And we know that bullying and harassment are severe problems within our workplaces. In fact, the Canadian Safety Council estimates that bullied employees spend 10 to 52% of their time networking for support. They're going around the workplace trying to find people to support them. And in a lot of cases, it's not happening. And workplace bullying creates conflict. And what the Canadian Safety Council is saying is that conflict, when it's unresolved, is causing about 50% of employees' departures. So we know it's having a huge impact on turnover. And there are some recent reports that show that, believe it or not, there's really high numbers of Canadians who say that they have been bullied once a week for the last 6 months in their workplaces. And this is having a huge impact on business outcomes. I mean, in every area. Now, Gina, you had asked about the ROI. Yes, there are studies that show the ROI. But one of the things that I want to focus on is the fact that what we need to be looking at is called value on investment. Because when we look at value on investment, we're looking at more than just the straight ROI of, we spend this much and then we reduce our costs for absenteeism or claims by this much. What VOI looks at is the full value of the employer investment and all the business outcomes, all these areas that you see on this slide here, and the employee investment and the impact on their health and their well-being, which of course is also going to have an impact on all these different business outcomes. So there really is a value on investment. I mean, what they say is that the return on investment is estimated to be at about 3 to 1. Value on investment is many, many times that. So let's have a quick look at the legislation and standards. The Alberta Action Plan for Mental Health. I'm not sure if you're all familiar with it. If you're not, I would definitely recommend having a look at it. Recommendation number 20, which is buried within it, says that they want Alberta to support individuals with addiction and mental health issues in their workplaces. And you'll notice that it says developing mental health workplace training tools, preventing discrimination, and providing support and treatment. And also implementing the national standard for psychological health and safety in the workplace, and a few other things there. So the point is that Alberta Health is looking for employers to take a stand on this. And that is why you're seeing the changes to the Occupational Health and Safety Act. Now, what we know is there's a lot of changes. I mean, this act has been through sweeping changes, and I know that some employers are really reeling from it. Others aren't, because they've already got great workplaces and they have this stuff in place. But one of the things that I've seen missing from a lot of the communications, not from WorkSafe Alberta themselves, but from others who are out there talking about the changes to the Act, is that they seem to be either not talking about the change to the definition of health and safety, or maybe they just don't realize the impact of that change. And I recently met with representatives of WorkSafe Alberta when I trained them on the National Standard of Canada, so that their inspectors know kind of what they're looking for when they go into the workplace. And we talked about this definition of health and safety, and they said, yeah, it absolutely includes physical, psychological, and social well-being. And what's going to happen is if they get a call from a worker who is complaining that there is workplace harassment or bullying or violence in their workplace, they have to go in and investigate that. And then what's going to happen is once they're in your workplace and they're investigating it, they're going to start looking for evidence that you have a full program in place to support physical, psychological, and social well-being. So that is a really important change. You'll notice that the purposes of the Act, I have it highlighted here. It's promotion and maintenance of the highest degree of physical, psychological, and social well-being. They are really integrating the whole psychological and social well-being aspect of this. They've defined harassment. And what you'll notice in the definition of harassment is that they've actually adopted the Human Rights Code definition of harassment into the Occupational Health and Safety Act. So now it actually states any single incident or repeated incidents of objectionable, unwelcome conduct, comment, bullying, or action by a person that the person knows or ought to know will or would cause offense or humiliation to a worker, or that adversely affects the worker's health and safety. And of course, as I mentioned, health and safety is defined as physical, psychological, and social well-being. So that comes into this definition. So this includes things like conduct, comments, bullying, or action because of race, religion, religious beliefs, color, physical disability, mental disability, age, ancestry, place of origin, marital status, source of income, family status, gender, gender identity, gender expression, and sexual orientation. It also includes sexual solicitation or advance, but it excludes any reasonable conduct of an employer or supervisor in respect of management of workers at a work site. So you might be wondering, well, what does that actually mean? Well, we'll talk about that a little bit more in a moment. One of the other definitions that I want you to really pay attention to as well is that they've actually defined hazard as a situation, condition, or thing that may be dangerous to health and safety. And again, that deals with the whole new definition of health and safety. So now, when you think about these changes, I want you to think about how this new definition is going to affect the organizations you serve. What do you think? And please feel free to type it in the chat box or in the question box. So Gina's saying, will they be fined? They might just ignore it. We're going to talk about that in a moment. So here's the thing. When people in an organization don't know what the law is, or they don't know what the changes to the law are, they cannot use ignorance as a plea. Darlene's saying, I don't think it will change much unless they enforce it. And you're right. And that is exactly why I had that discussion with the government of Alberta, with WorkSafe Alberta, to ask them, well, how is this actually going to be enforced? And the answer that I had was, well, if an employee calls us in to look at a case, a complaint of bullying or harassment, we're going to be looking at that very closely. Now, you may think that that's not going to happen, but I can tell you that the lawyer for the WorkSafe Alberta told me that they receive about 4,000 to 5,000 complaints a year, and they have to investigate them all. So they are out there looking at this. Now, Gina, you were asking about the penalties. So here's the penalties, and the penalties have gone up in this new act as well. So for the first offense, there can be a fine of up to $500,000 plus $30,000 a day each day that the offense continues beyond the first day. the person can be imprisoned for up to 6 months or both. Now, a second offense, those are doubled. Now, in my experience, having worked with Gowlings for 6 years, working with the top lawyer, occupational health and safety lawyer in Canada, one of the top, I should say, I can tell you that when employers and supervisors are charged under the Act or the regulations and they need legal defense, whether they are pleading guilty under a plea bargain, there's usually more than one charge laid, and sometimes they plead guilty under a plea bargain. Other times they decide to fight the charges because they figure, hey, we've got a due diligence defense and we're going to go to court and fight this. No matter what way that is, even if they do happen to either have a very low fine or no fine at all and no imprisonment, the costs of fighting that are huge. I mean, we all know that lawyers are expensive and the costs of fighting that are huge. And then if there is a fine, you can add a 25% victim surcharge on top of this. And that's basically a tax that goes to victim services. So you really want to try and avoid these kinds of cases. And as I said, we're seeing that there are more fines happening. We are seeing that there is imprisonment definitely for the traditional occupational health and safety stuff. But we're in a new era now. And Government of Alberta is the first government to actually put this right into the Act with respect to the psychological and social well-being. Now, when we were developing the national standard, I had discussions with regulators across the country, and they were saying, you know what? Of course we can enforce it. It's the general duty clause is for health and safety, and psychological health and safety is covered by that. So even though they weren't going to adopt the national standard into the legislation, they said we have the power to enforce psychological health and safety in the workplace. The main things that they look at are workplace bullying and harassment, but they also look at some other things as well. Now, Ben, you had talked about suicides, and we are seeing an increase in suicides, work-related suicides. I've just put a couple of them here. We know, for example, that this woman in Saskatchewan lost her husband to suicide not too long ago, and Workers' Compensation Board there attributed the suicide to being bullied at the workplace. In PEI, again, a widow awarded benefits after a 3-year fight with WCB and an appeal. And they finally awarded her benefits after it was shown that his heart attack, which he died from, was linked to workplace bullying, years of workplace bullying. So what we're seeing is that it's coming to a head. And Ben's asking, has this been enforced as of yet in this space? I haven't seen the enforcement in the space yet. What I am seeing, though, is workers' compensation being attributed, which brings me to my next slide. So in Alberta, psychiatric or psychological injury with respect to chronic onset is compensable. And there are entitlement criteria around that, which we'll talk about in a few minutes. We know that there's the duty to accommodate. I'm not going to go into detail on this slide. It's kind of beyond the scope of this presentation, but if you'd like more information about the duty to accommodate, I do go into that in more detail in my course on accommodation of workers with mental health issues or mental health needs. And of course, when you're trying to get information from the doctor or from the employee about accommodation, sometimes you will end up with information with respect to their health. And so you have to follow the Health Information Act and make sure that that whatever health information is being collected is also being protected. Okay. So let's talk about the entitlement criteria very quickly. So entitlement for workers' compensation when it comes to chronic stress there's some requirements. First of all, it has to have arisen out of and in the course of employment. And, you know, when you have to note that WCB covers psychiatric or psychological injuries when a worker has been exposed to a traumatic event or events. And when it's considered to be chronic, then that is covered under this as well. When there's a diagnosis of psychological injury by a physician or psychologist, they're going to presume that the injury arose in and out of the course of employment. Okay, so when questions arise, then they go into further investigation to determine what the appropriate benefits are going to be. Now, when it comes to chronic stress, what they look for is that there's an emotional reaction over time from a number of work-related stressors or a significant long-lasting work-related stressor or both. So something like workplace harassment or bullying would definitely fall under that. But there may be other things like excessive workload, may fall under this if it's excessive in comparison to what other workers would be dealing with. And that in itself is a big issue because they have trouble trying to determine, well, is it really excessive in comparison to other workers, or, you know, is it excessive, period? Because just because everybody has an excessive workload doesn't make it right. So they're dealing with those kinds of questions as well. They also have to have a confirmed diagnosis of mental illness under the DSM-5, and there has to be objective confirmation that these events have happened. The events have to be able to show that the events were excessive in intensity and duration, and that they were the predominant cause of mental illness, of the mental stress injury. Now, this raises a question. We know that compensation boards in various provinces have decided to provide benefits in this area. The predominant cause test is being fought because they're saying that it is unconstitutional. It could end up going to a charter challenge because it still puts employees at being treated differently than if it was a physical injury, because with a physical injury, you're only looking at significant cause, whereas with psychological injury, it has to be the predominant cause. Now, what they'll look at is what are the normal pressures and tensions. It's not compensable if it's related to interpersonal relations and conflicts, health and safety concerns, union issues, or employers' actions and decisions. And that's really, really important because things like terminations, demotions, transfers, discipline, changes in working hours, changes in productivity expectations, those things are not covered. They are considered to be normal pressures and tensions of the job, but we're going to talk about that again in a little bit. When it comes to interpersonal conflict, they haven't defined it, but I looked up what I felt was a really good definition of it from psychologyandsociety.com, and they've said a disagreement between two individuals and subgroups of an organization involving significant resent and discontent. Now remember, when you've got significant resentment and discontent, that's accounting for 50% of turnover. So this is, you know, when you start to look at that whole value of investment, even if it's not causing somebody to go off on workers' compensation, this can be causing them to leave your organization. And then you have to think about your training costs and hiring costs. Now, there's a landmark case here, Martin versus Alberta, which talks about reasonable adverse employment conditions versus excessive or unusual work-related events. And I'll be happy to get into that in more detail with you if you'd like to give me a call and talk to me about that. But what they're basically saying is that you really have to look at, even though there may be something that is adverse, it doesn't necessarily mean that it's excessive or unusual. So in this case, the employee had been asked to provide his computer so that they could look and verify what was on it. He said that that caused him chronic stress. He was denied. It went to appeal. The denial was upheld in the appeal. Now, the thing is that focusing on the board's policies aren't going to help you. You have to see the stress before it blows up. So there's a few recommendations on these next couple of slides, things like having a clear policy and process to identify, what could be considered as adverse versus excessive or unusual. Making sure that's communicated clearly to all employees, making sure management is trained and that they understand the benefits and the risks involved, being consistent in the application, making sure that HR, senior management, and the union support those decisions. And that's really important. A few other things that you might want to have in place. Psychological demands analysis so that you can actually identify, well, what is excessive and how can we reduce the risk? And then a few other things as you see on this slide here. So finally, we're going to talk a little bit about preventing disability from stress. These are some strategies to improve your success and reduce the risk in your workplace. Now, I'm a member of the International Association on Workplace Bullying and Harassment, and what they have said is that really it's the methods of management themselves that violate the respect due to each employee, and that is causing them a lot of harm. So what you need to have in place are things like education and training, workplace watch. Now, the workplace watch is very similar to in regular occupational health and safety, we do inspections of the workplace looking for hazards. Well, a workplace watch is having trained people watching for signs and symptoms of things like harassment, bullying, and chronic stress among employees. Have a complaints procedure, your investigation procedures, and you have to make sure that people are properly trained in investigating these types of things. And in some cases, you may need to call someone external to the workplace in to do those investigations and help out with conflict resolution. And conflict resolution is not coming to a truce. It's truly resolving the conflict so that there isn't that underlying ongoing resentment. And then making sure that you've got a process for implementation. Now, you might want to have a look at the National Standard of Canada. They do talk about the workplace factors that impact psychological health and safety for better or for worse. And you want to find out, is accommodation actually needed if an employee is suffering from chronic stress or is suffering from a mental illness, for example? So sometimes it's not accommodation that's needed, but it's changes to the workplace that are actually needed to reduce the risk for everybody. The process in determining whether you need to accommodate someone is, first of all, making sure that you are comparing their psychological abilities and limitations, as well as their triggers and support needs, with the psychological and physical demands of the job. And notice that it does say psychological and physical demands. Most of the organizations that I have been consulting with, they've done a really good job at the physical demands, but not necessarily the psychological demands. They might have some cognitive demands identified, but it's not enough. And then you want to determine if the job resources are adequate, and you want to determine if the personal or if it can be augmented with personal and community resources as well, and whether there's any job modifications that need to be made. And if you'd like to know more about that process, then certainly you can attend one of my courses. Now, there's 3 key questions, and these are so important no matter who you're dealing with. If you've got someone who is suffering from chronic stress, you want to ask them, what are you doing to care for yourself? What can we do to help you succeed? And how should we handle future situations? Because you want to make sure that you're trying to keep that person gainfully employed, that they're in the workplace, that they're able to cope, that they know that they're being supported. There's some really good ways of communicating and allowing for those pauses, managing your eye expressions, seeking clarification. really allowing for the pauses is so very vitally important, because when someone is suffering from chronic stress, as you saw from looking inside the mind, it's really difficult to communicate. So you have to give them time and space to be able to try and clarify what it is. I remember going through the burnout, and it was difficult for me during those times to express myself because my mind kept going in circles. You want to make sure that they've got access to programs, employee assistance programs, as well as other employee benefits and health coverage. And if you'd like, you can request a copy of my free guide on the 7 critical questions for determining whether your health benefits are actually helping workers with mental health needs. And now I'd just like to quickly invite you to take a deeper dive. Back to Albert. Chronic stress is a serious and preventable workplace hazard. Now, I was reading an article just recently in LinkedIn that said that, they have more access to data than anyone. And what they're saying is that there is a huge, significant skills gap. And it's a skills gap in management and leadership in organizations. And that is, the gap is in interpersonal skills. And they can be nurtured, they can be coached, and it's really important to do that. So what I wanted to invite you to do is, if you want more help in this area, I'd be happy to come in and talk to your organization or your association. Here's some of my most requested speaking topics. Some of the courses and training that I offer, I'm just going to quickly run through them here. This course is a 2.5-hour course on mental muscle, and this is for developing a coping plan. And the people that have gone through this program have just loved it. And I'm actually going to be developing this into a coaching program as well. Psychological health and safety risk assessment and action planning. That's a 2-day course that actually takes you through the process of how to identify the psychological health and safety risks and in an integrated way, and put the action plans in place to reduce the risk of harm. This one here, how to manage accommodation and return to work when mental health is a factor. This is a full-day course, and you get some fantastic resources to go with that, and I've had amazing feedback from that. And just to give you a sneak preview, I will be doing a 1-hour webinar on October I think it's the 9th, is it? I just have to find the date for that. Sorry, Friday, October 12th. I'll be doing a 1-hour webinar that'll be the registration will be open later today for that. So that would give you a sneak preview to that if you want to see what's included in there. Another course that I offer is how to prevent and manage chronic mental stress claims from harassment, bullying, and other workplace stressors. And as you'll see, I just get amazing feedback from the courses and the programs that I offer. And if you would like more information on those, then feel free to visit my website, and I'm happy to help out. I've been really serving a lot of people with these, and they're very happy with the quality of the information that they get. They're happy with with what they're actually able to do with it afterwards. So yeah, I'd love to help you flourish. So if you would like in-house training for your organization or your association, I offer it both in person or live online. If you're looking for coaching for employees in leadership roles to help to close that skills gap, or if you're looking for some consulting to get your organization started, or if you are a consultant looking to improve your impact in this area for your clients, I'd love to talk to you about commissions for referrals. And one final thing is that you're going to get a gift for attending this session today. I'm going to give you a gift of 10% off of your first service. So if you go for any one of these services, except for the consultant commissions, of course, because then I'm paying you. But other than that, and any of the other services that you sign up for, you'll get 10% off of your first service. So I would just like to share something with you before we finish. And of course, it came up on the wrong one.
Elizabeth Rankin-Horvath is the president and founder of Hale Health and Safety Solutions. She has over 20 years of experience consulting and training employers on workplace health and safety. Elizabeth is considered one of the foremost experts on the psychological health and safety standard and was a contributing member in the establishment of that standard. Due to recent changes in legislation in Saskatchewan, we established a mental health best practice group composed of 60 of the largest organizations in the province who are all committed to adopting the CSA standard for psychological health and safety. This group is committed to leading practices and as such identified chronic mental health as being one of the first areas for their journey. After careful research, we identified Elizabeth's program as being not only the first, but the preeminent program in the country when it comes to this issue. The Mental Health Best Practice Group loved Elizabeth's style of delivery, which was conducive to open discussion and learning and sharing of information. In fact, there was so much information packed into the session, the group would have loved a second day. The key benefit that the Mental Health Best Practice Group got out of the program was a thorough understanding of the complexities of chronic mental health. In addition to that, they got real resources and tools that they could put in place right away. I think we can all agree that psychological health and safety is the next frontier for employers who want to treat their employees right and get the best possible results. I would definitely recommend Elizabeth for anyone who wants to get a handle on this right away.
So I want to thank you for joining me today for this this very special webinar. And we'll just, I do realize it's a couple of minutes over time, but if you'd like to stick around and ask some questions, then I'm happy to answer any more questions that you have. And thank you, Gina, for your comment on the great program. Thank you very much. So does anyone have any questions? I'm happy to unmute your phones. I'll see if I can do that so that everyone can actually talk. Trying to unmute the phones. You might have to unmute your own phone because I have hit unmute for everyone. So Ben is asking, how can we create more awareness of this issue with employers? Well, Ben, that's a really great question. And I think that, you know, getting out and doing more talks like this, you know, if you have access to associations, you know, industry associations, as you saw with George Marshall there, he's the CEO of Service and Hospitality Safety Association in Saskatchewan, and you know they do a lot of work in this area and really trying to get the information out. So, you know, if we can get out to the associations and get talks like this going and maybe pull together forums, focus groups, things like that, where we can get employers together talking about what these issues are and how it's actually impacting their workplaces, then we can create more awareness, but we can also help them with what the solutions are, because awareness is only half of it. And that's what I usually find, is that so many employers, when they're coming forward looking for answers, they don't want to just be scared. They don't want to just have, oh, well, here's what the changes are and here's what the problems are. They want concrete solutions. And that's why I've developed the programs that I have developed, because I want to leave people with concrete solutions that they can actually make improvements with, that they don't have to develop from the ground up. So hopefully that helps. So Ben, you're saying we serve an association, the AASP, with over 3,000 members, but I'm not sure that they even know that they have a problem. Well, Ben, if you'd like to talk about how to look at getting this information out to them, I'd be happy to have a conversation with you about that. Do you have something we can share? Absolutely. Okay, anyone else? Okay, looks like I can't unmute everybody at the same time, but if you would like to talk, you can put your hand up and I can unmute you. Okay, well, it doesn't look like anyone else has any questions. So hopefully I did address your questions throughout the webinar, and you will get a copy of you will get an email with access to the webinar. So if you want to listen to it again, feel free. And if you have any other questions, or if you'd like to sign up for any of the courses, then I'd be happy to talk with you about that as well. And don't forget, you have your 10% off. Okay, so thanks for joining me today, folks, and I hope you have a wonderful afternoon. Let's make work a great part of life. Bye for now.